Okay, so today I'll be doing my peak flow meter comp, and to start off, what I would do is check my orders, check for any contradictions, anything that would limit me from doing this test on the patient. I would gather my equipment, which would be my peak flow meter and my little journal I have here, and of course a pen or a calculator, whatever I needed. I would knock on the door. Once the patient said come in, I would come in. I would wash my hands, put on my gloves, verify my patient's name and date of birth, and then I would start explaining what I'm here for today. So I'm here today to teach you how to manage your asthma. So what I have with me today is what I like to call a peak flow meter. It's just a little toy or tool to help you gauge where you're at with your symptoms. So I'm going to teach you how to use it a little bit. I'm going to have you kind of repeat it back to me and perform the test, and then we'll go over writing down what you perform on it. Okay? Okay, great. So what I'm going to have you do is either be standing up, feet flat on the ground, or sitting down, feet flat on the ground, and make sure your back is straight. And after you do that, what you're going to do is take this tool and you're going to shake down this little yellow piece until it's closest to this mouthpiece right here, or at 60. And then what you're going to do is create a tight mouth seal around this mouthpiece right here and blow as hard and as fast as you can. When you're blowing into it, make sure your cheeks aren't puffing out like a little fish, like this. And make sure you're not sticking your tongue in this little hole down here, just so the measurements are correct, okay? So I'm just gonna have you do that 3 times for me, okay? The patient would do it 3 times. I'd write down the 3 times they do it, making sure that every measurement I get is 40 liters in between each other. So for example, if they did 350 the first time, the next time needs to be 390 or 310, like that. Okay? So I charted my little things right here. Now, what I'm going to explain to you is how to write down your measurements and things just to help you manage your asthma. So what you're going to do at home is you're going to take this little tool right here, or this toy, whatever you like to call it, and you're going to try to do what we just did in the morning and at night. And what you're going to do is write down those 3 big blows that you give into this little tool right here. You're going to write down those 3 measurements. So let's say that first time you get 300, you're going to write that down. And let's say the next time you get 400, you're going to repeat the test, okay? We want to try to get those measurements 40 in between each other, okay? So let's say, again, you do that 300 and then you blow, get a measurement of 340 the next time, that's acceptable. Or if you're to do 300 that first time and get a measurement of 260, that's also acceptable. Does that make sense to you? Patient says it makes sense to them. Also, just want to clarify, this patient is a 17-year-old asthmatic, okay? Okay, great. So what you're going to do is write down those 3 measurements that you get, and you're just going to circle the highest one, okay? So again, let's say you blow 300 2 times, and then your 3rd time you blow, get 340, you're going to circle that one. That one's what we're going to call your best one for the day, okay? And you're going to do this for 2 to 3 weeks, okay? And you're going to do it in the morning or at night, preferably from 10 to 12, 8 to 10, like that. Pre and post your inhaler. So before you take your inhaler and after, and then anytime you're having symptoms, like maybe a tight chest, maybe a little bit of wheezing, anything like that, try to do this for us, okay? And after those 2 to 3 weeks are up, you're gonna write down, go back through all of those measurements you've written down and circle the highest one you got out of all of them. And that's what we're gonna call your personal best. And that'll help us manage your asthma even more, okay? After those 2 to 3 weeks and you get that personal best, how that helps us manage your asthma better is that we have this little sheet right here. Pause for a second. What you're gonna do is blow into it, of course, like I showed you earlier, and then you're gonna see what range you're in, okay? So I've already did your calculations for your measurements. So green for you is 280 to 350 because these times that you blew it, the times that you did the test in the room with me, you got 350, 350, 330, okay? So what I'm gonna do is write down those ranges for you. Your ranges for green is 280 to 350. For yellow, it's 175 to 279. And then anything less than 175 is the red zone. So whenever you're in the green zone, you're all good, you're all set to go. If you feel like taking your inhaler, you can, but other than that, you're all set. Yellow is maybe you have some symptoms like, again, you feel a little bit out of breath, anything like that. This is take your medicine and maybe think about calling your doctor. Just really depends on how you're feeling at the moment. If you hit that 175 marker on this little toy right here or tool, definitely call your doctor. Try to go to the emergency room and definitely take your medicine, okay? This is a good thing to carry around with you just in case of an emergency or anything like that. Again, if you wake up and you don't feel great, but you don't have wheezing or a tight chest or anything, it's good to do this little test for yourself just to make sure you are within this green zone and, you know, rule out that it is an asthma attack or anything like that, okay? I'm going to send this home with you. I'm going to give you a little tiny journal to use to calculate your stuff. I'm going to have you perform this test one more time for me just to make sure you understand. And then I'm just going to have you repeat those instructions back to me. And if you have any more questions, I'll try to answer them for you, okay? Patient blows. I shake it down. Patient blows. I shake it down. Or she shakes it down. Patient blows. Shake it down. She repeats back the information to me, yada, yada, yada. It's correct. She understands. Okay. I'm just going to send you home with these things right here. Right here. Okay, is there anything else? Is there anything else you'd like me to do before I leave the room? Maybe change around some things, turn on the lights or anything like that? Turn off the lights, sorry. Turn off the lights or anything like that? Okay, awesome. If you have any questions, you can call your doctor or ask your nurse right outside, and they'll be more than happy to answer them for you before you go home with this, okay? And I can come back if you need be. Okay, awesome. Take off my gloves, all that stuff. I'd exit the room, sanitize, of course. Chart what I've gotten and all that stuff. And yeah, I think that's it.